Why does systemic inflammation cause dry eye? Systemic inflammation can lead to dry by triggering an ongoing inflammatory response in the tissues around the eyes and in the glands that produce tears. This inflammation damages these tissues, disrupting the normal balance of the tear film and the surface of the eye. When we talk about systemic inflammatory disorders, conditions like Sjogren's syndrome and graft-versus-host disease come to mind. These diseases cause persistent inflammation in the connective tissues around the eyes, including the conjunctiva, lacrimal glands, and meibomian glands. This chronic inflammation can impair tear production and alter the composition of tears, resulting in dry eye symptoms. The immune response involved in this process is quite complex. Various immune cells, such as T lymphocytes and macrophages, become active and releases substances known as pro-inflammatory cytokines. These include interleukins and tumor necrosis factor. These cytokines can damage the cells on the surface of the eye and disrupt the tear film by breaking down important cell connections and components that keep the tear film stable. Another aspect of systemic inflammation is tear film hyperosmolarity, which means there is an increased salt concentration in the tears. This condition stresses the cells on the cornea, leading them to release more inflammatory substances. This creates a cycle where inflammation worsens the quality of the tear film, causing even more damage to the eye's surface and increasing dry eye symptoms. Chronic inflammation can also lead to a loss of goblet cells in the conjunctiva. These cells produce mucins, which are vital for keeping the tear film stable and providing lubrication. When goblet cells are inhibited, the production of mucus decreases, further destabilizing the tear film and worsening dryness and irritation. Additionally, systemic inflammation can cause structural changes in the glands that produce tears. Inflammatory cells can invade these glands, leading to fibrosis and atrophy. This damage reduces the production of tears and the oily layer of the tear film, making evaporative dry eye more severe and potentially leading to chronic dry eye disease that is hard to treat. Recognizing the link between systemic inflammation and dry is essential for effective management, especially for those with autoimmune diseases. Treatment strategies often involve anti-inflammatory therapies aimed at reducing inflammation in the ocular surface and tear glands. Managing systemic inflammation through proper medical care can help alleviate ocular surface inflammation and improve dry eye symptoms. Early diagnosis and intervention are crucial to prevent irreversible damage to the glands and chronic dry complications. Understanding how systemic inflammation affects health can guide better treatment approaches and improve the quality of life for those affected. Always consult a healthcare professional for personalized advice and treatment options tailored to individual needs.